Today I'd like to talk to you about hypertension. And I'm going to relate it to the dental side, being a dentist, but also give you a brief general history of how it relates whole body and what we know in medicine. And so what are the main contributing factors? And a person can have one or many of these which can be contributing to their hypertension. Hypertension is a fancy name for high blood pressure. And the problem with high blood pressure is that it's very hard on all the organs in the body, and it really can increase the aging process for people and puts them at greater risk for stroke, heart attack, and other ailments, none of which are good. So learn about this and then see what you can do if you need to make lifestyle changes. Now, the first one is the most difficult, and that's genetics. So some people are born into a family where people in the family have hypertension as they get older. But even though there's genetics involved and they might be predisposed, there's also lifestyle changes that you can do as well that can help bring down your hypertension naturally without medication. Number 2 is diet. So what do I mean by diet? So we want to eat healthy foods. We want to eat plenty of proteins and green vegetables and things like this. If we're consuming a lot of sugary foods, we're consuming a lot of carbohydrates, especially the processed carbohydrates, it spikes insulin in the body. Insulin can create, if there's too much, it can create inflammation in the body. The inflammation gets into the bloodstream, which makes the vessels in the bloodstream more tight, more rigid, so they can't expand and contract nicely, which can lead to hypertension. Some studies show that excess sodium or problems with potassium metabolism can relate to this problem. But there's more studies now saying those that are on restrictive sodium diets could be also becoming micro-mineral deficient, or the small minerals that our body needs are very important. So those factors one has to look at. So the third thing is physical inactivity. You know, the idea, move it or lose it. So you want to be able to be walking, stretching, even for men and women after they hit their 40s and 50s, you want to be able to use resistance activities like weightlifting or the bands that you can stretch, etc., that actually stress and strain the muscles without hurting your joints. So that's very important. They go into a sedentary lifestyle, they're more apt to end up developing hypertension. Number 4, that's obesity. If you're obese, overweight, and you're working out all the time, that's generally diet and hormone related. And usually from the diet side, on that one, it's from too high of a carbohydrate consumption. But you can check your glycemic index on various foods. There's monitors now people can wear. When they eat a different food source, they can see where the glycemic index goes. Okay, now I'm just the messenger on number 5. So it's alcohol and tobacco use. Now, alcohol and tobacco use, not a problem, but excessive use of these can increase blood pressure or create hypertension. And why is that? Because truthfully, alcohol is a poison. In small amounts, we enjoy it, it's social, and so is tobacco. I mean, our bodies are not suffering from a deficiency of alcohol or a deficiency of cigarette or cigar smoke, right? So those are recreational, but they play a role on the body, and sometimes they deplete different vitamins, nutrients, and minerals in such a way that it can lead to hypertension. Number 6 is stress. Stress is like a big number 1 cause for so many illnesses, because then the body would normally be able to recover from that illness, but it can't because it's so suppressed, it's so oppressed that the regular mineral and enzyme reactions happening in the body are not working. The 7th item on the list, poor sleep. So if a person has too much stress, their cortisol levels are up at the wrong times, they don't sleep good because of it, and then they wake up early, they can't go back to sleep, and then they're frustrated, which creates more stress. It's like this vicious cycle. And by the way, a lot of our detoxification happens while we're sleeping. We're burning calories while we're sleeping, believe it or not. And if that's done and we detox properly, the body operates at its full functionality. Now, the eighth one that I'm going to talk to you about is the oral health, your mouth, because the mouth plays a pivotal and key role in converting nitrates into nitrites, which becomes nitric oxide. That's a lot of interesting terminology there, but nitrates come from green leafy vegetables, from beets, and the body takes those and converts them into nitric oxide. What's the significance of nitric oxide? Nitric oxide is the key molecular and enzyme development that happens that actually gets into our bloodstream and signals the bloodstream and the muscles in the bloodstream to stay flexible. So they cause what's called vasodilatation, which is our dilation of the blood vessels naturally. If nitric oxide decreases, then the tightness in the arterial system begins to go up and we start seeing hypertension. Again, what's that got to do with your mouth? Well, in the back of the tongue and in our saliva, our body accumulates nitrates. And those nitrates are so important because it's pulled out of the saliva, it pulls in the back of the tongue to a point of a 20-to-1 concentration. It's very concentrated. Body does that because it takes those nitrates, gives them to the bacteria that live on the back of your tongue, and those bacteria work with us over eons of evolution and development, and they convert nitrate into a molecule called nitrites. It's a more reduced form, and then we swallow that, it goes down into the gut, etc., and then it gets into the bloodstream and is converted into nitric oxide. So a couple of things on your side of things that you can do. Number one is if you have good balance, good oral hygiene, you're going to be fine. But if you're doing things that wipes out all the bacteria, like an alcohol-based mouthwash, or if you're using a medicated mouthwash with chlorhexidine or some other strong ingredients, you'll begin to wipe out all the good and the bad. So if you have some gum inflammation and you're taking that short term, generally not a problem, but you want to rebalance out the bacteria in the mouth. Now, if the balance is good, then we have the proper amount of healthy bacteria, especially in the back of the tongue, and they're called streptococcus. Now, that's a fancy word. Streptococcus just means, strepto means long chain or beads, and coccus means circular or actually bead shaped. So you have a chain, streptococcus means a chain of bead-like or bacteria all lined up in a chain. So the other thing is, if you do have gum disease, we call it periodontal disease because it's around the tooth. Perio means around, dontal means tooth. Periodontal disease. If a person has that, that means they have deep pockets, they have bleeding gums, they probably have bad breath. If you're someone listening and that's happening, you can use various products to get that under control, but you want to work with your dentist and make sure you reduce those pocket areas. If the imbalance gets worse with gum disease, it can affect the healthy bacteria in the back of your tongue. And then you're not going to convert nitrates to nitrites and to nitric oxide. Main thing is you don't want to now take a chemical mouthwash that has predominantly alcohol in it, swish your mouth with it because you're going to wipe out all the good bacteria. So this is the link to hypertension, and studies support this, and it shows that people that are using these types of mouthwashes that wipes out all the good, lo and behold, they get hypertension, or they can get hypertension. So now they go to the medical doctor, and the medical doctor says, well, tell me about your diet, tell me about your stress level, let's check your kidney, let's check your hormones. And one of the questions that should be asked is, tell me about your oral hygiene. What's happening there? And there's a bit of a disconnect. But the studies support this and show that if a person's taking these types of strong mouthwashes, we then begin to see or can see a rise in blood pressure, which would make sense because theoretically, you're retarding that aspect going from nitrates to nitrite to nitric oxide. So the moral of the story is there's a lot of these lifestyle changes that a person can do to handle hypertension without having to do medication. If it's way out of control, work with your medical doctor. You may be on some medication for a short amount of time, but if you're overweight or your diet's out of control, you're not exercising, not working out, even walking, and then you have gum disease on top of it, it's like a perfect storm for hypertension, which then can lead to heart troubles. It can also lead to heart attack, stroke, all the bad things that you don't want to suffer. All this can be preventable with a little bit of awareness. So there you have it. There's the connection between hypertension and the mouth and the other avenues that hypertension can come from.